Association of Athens, Dr. Ledger, Dr. Caputo, esteemed colleagues. It's a great honor for me to be awarded with such a prestigious award today. And found for him a job at New York Hospital. His first job here was in charge of watching the microscope of New York Hospital. Subsequently, he was offered a position at the Department of Anatomy under the auspices of Dr. Charles Stockard, who was the professor at that time, as an independent scientific researcher, and started his research. And then I was trying to connect alcohol in pregnancy, or alcohol, to this, to Dr. Papanikolaou, and I was impressed to find out that his first research work examined the degenerative effects of alcohol poisoning on guinea pigs. His first observations referred to the effect of alcohol poisoning on sex differentiation and other hereditary factors. Subsequently, of course, he was busy with the cycle in relationship to the hormones. He could predict ovulation. I had the honor to meet people here when I arrived in New York who told me, I owe my child to Dr. Papanikolaou because he was checking my wife, and then he told me, this is the day that you have to make the baby. And I went home, I made the baby, and here I have my son. So he was very great supporter of the fertility aspects of our people here in New York Hospital. And of course, the big discovery of the abnormal cells and the cytologic examination of the smear. And it is very, very interesting to me that although his official atlas of cytology was presented in the 40s or 50s, Dr. Fleming, the inventor of penicillin, who made his discovery in the 20s, but penicillin became available for treatment of infections during the Second World War in the 40s. So something similar happened with Dr. Papanikolaou. So I'm going to go now into the what Dr. Caputo mentioned about alcohol in labor and delivery. It was the first method that gave 48 hours postponement of preterm delivery by making a mother drunk and making also, incidentally, the baby drunk. And yes, the delivery was postponed, and yes, it was repeated again a week later or a month later in the event of preterm labor, and it was effectively providing that the cervical dilatation was not more than 4 centimeters. Nevertheless, there was no concern about the effect of this treatment to the baby. And by the way, that treatment was used extensively in the United States, all over the States. So with the guidance of Dr. Fritz Fuchs, the then chairman of Obstetrics and Gynecology, Dr. Alfred Krauss for pediatrics, and an enthusiastic young maternal-fetal medicine fellow that you can guess who he was. There was a study that here at Cornell examined the outcome of babies that were born under the influence of alcohol. And in this very early study, it was noted that the 1-minute Apgar score was depressed, was lowered, and also there was a higher instance of respiratory distress syndrome in infants born within 12 hours after administration of ethanol. In parallel, the status of the fetal alcohol syndrome started going on or continued going on. And so there was a second thought about continuing using alcohol in pregnancy. So the technique was gradually abandoned. So in that part, for that effectiveness, research was done here at CORNELL and 48 hours again after its administration. That showed potential risk of using alcohol in pregnancy at New York Hospital, following the example of the Society of New York for giving me the opportunity